Hello, everyone, and I am thrilled to be here on Facebook with you all with Dr. Anna Nix. We are so thrilled to feature her for our Airway Health Solutions Spotlight Series. And welcome, Dr. Nix. You're from Mississippi. Why don't you just tell us a little bit about you, and then we'll kind of dive into your journey and showcase the work you're doing.
Well, I'm so excited to be here. I live in Madison, Mississippi, but my practice is in Clinton. I've been practicing pediatric dentistry since 2018, and I'm the only dentist at my office. We see a wide range of children, all different kinds of children, some special needs, and it's just the best job in the world.
Well, you make it that way, right? Because you're not doing the mundane, you're doing much more than drilling and filling. And
Yes.
tell us a little bit more about that. What makes it so rewarding for you every day at
So
focusing on airway?
before I was in airway, I had stumbled upon some article that was talking about how mouth breathing can cause cavities. And so I have several families with multiple children. None of them had cavities in the family except one child. And they eat the same foods, they have the same hygiene, and you look at them and they're sitting there like this, just mouth breathing. And so I stumbled across an article, like a CE course that was a really small CE course, maybe an hour long, of Dr. Miraglia, and it was just life changing. And so incorporating the things that I have learned in those courses my career has been transformed. I mean, every way that I look at each and every one of my patients has completely changed, and it's been the most rewarding experience.
Well, let's start because it warms my heart because we all have a story, right? It starts with, I was so inspired to share this message, scream it from the mountaintop, like you had mentioned.
Yes.
And here we are, I'm reaching you, and now in turn, you're reaching all of these children. But where did it start for you? Like, where did the most impactful part come through?
So the most impactful thing so far has been treating my children. So I have three little boys. They're 13, 11, and 9 years old, and they're all wearing expanders as we speak right now.
Wow.
So it's been just the coolest thing to see the changes in them. I mean, they both had their transmolar distances were really narrow. They all three mouth breathe when they sleep. And so just seeing the changes in them sleeping better throughout the night, waking in the morning more refreshed, being able to focus better at school. I mean, when you see that and experience it, even just for the very first time, you can't not want to do this to every child that you see who's struggling. It is the coolest thing.
It becomes a responsibility, right? It's like your ability to respond.
Yes,
changes.
That's so true. I had a patient just yesterday, and I had sent them to the orthodontist about a year ago, and I was just following up on, had they been to see the orthodontist lately? And she was like, well, they want to pull for premolars. And I was like, oh, well, let me just tell you there's another option. There's a million different ways to fix a problem. But if you want to do where we're fixing the root cause of the problem and we can create space and save those 4 permanent teeth that God created for your child to have, that's life changing. So it's just been really, really cool and kind of frustrating at times because you wonder, like, why is this not taught in dental school? And you want to just get the word out and get as many people able to provide that care as possible. And so it's been exciting and amazing and rewarding, but then frustrating sometimes because you're like, why are they still doing it this way?
Right. Well, we have that frustration, but we try to look at it as you don't know what you don't know, but now it's becoming so prevalent that's a more difficult excuse, I think.
That's so true.
Because it's becoming a little bit more mainstream, thanks to people like you, thanks to Airway Dentists, thanks to everyone who's kind of really leaning in and taking the road less traveled. But was it a hard adjustment for you, Dr. Nix, to kind of take what you learned conventionally and then it's almost like you need to do a 180? Want to touch upon that?
That's so true. I don't think that it was hard. It was just whenever I see a patient, there's so many more things that I incorporate now. I measure across their palate with the Bully gauge. I'm asking more questions. I have a screening form that all of my patients, the parents, fill out whenever we get a new patient, and that is just like like a general questionnaire about how they sleep. Do they mouth breathe? Do they snore? Have you heard about airway dentistry before? And a lot of these patients are like, oh my goodness, yes, like I saw something on Instagram that popped up about that. And we have patients come into our office now who have just heard about it and they want to know if it's something that we do. So I love that more and more people are finding out about this.
Yeah.
But I wouldn't say it made it hard. Like my practice did completely change. It actually made it more exciting and more rewarding because I truly feel like I'm helping these kids. I work really closely with a myofunctional therapist who's also a speech therapist.
Mhm.
So we do a lot of collaborating, treating patients together. And then also there's an ENT that I work closely with. So if we feel like we need the child to be screened by an ENT or to get a scope done to see the tonsils and adenoids, I just feel like we have all the bases covered and it is the coolest thing ever.
How long did it take you to integrate from taking the coursework with Airway
Um,
Health Solution
It
to
was like
doing
the
it?
week I was taking the course. I mean,
Okay.
I couldn't learn the stuff fast enough. And my husband is like, there needs to be a support group for spouses of airway dentists.
That's a good idea.
I think so
I'll put
too.
you in charge of that. How about
Okay.
that?
Yes. And
Right?
he's so funny. He's like, we need to have shirts that say, expand your palate, expand your mind. He just like giggles at me. But, I mean, he's seen the differences in our children too. But I started implementing the things that I learned, like literally as I was taking that first mini residency with Dr. Miraglia. It was just the coolest. It's the coolest thing ever.
And now the ages of your children, if you don't mind sharing, and
Yes.
we didn't discuss this, so if you want the privacy, I understand, but the
Oh, no.
ages of your children, and then maybe some of the symptoms that you started to see
Yes.
dissipate by age, if you can kind of break that down for us, everyone's always
Yes.
interested.
Okay, so I'll start with my youngest. He is 9 years old. He tossed and turned and woke up throughout the night. He mouth breathed when he slept. He didn't mouth breathe during the day, but eventually, after he fell really asleep, his mouth would just kind of droop open. And when he woke up in the mornings, he was mad at the world. And so that was one of the things that I noticed after, I mean, even a month or so of putting the expanders in, he woke up just happy as can be. He didn't get as frustrated during the day. He was sleeping deeper where he wasn't tossing and turning and kicking. And so I feel like for him, the impact that this had on his sleep quality just transformed how he felt during the day. I mean, it was really cool to see. He did have a really severe unilateral crossbite. And so the way that his smile looks today and his facial structure looks so much more symmetrical and so much more beautiful, I think.
Is that
Um,
the picture that you sent us in the
yes.
survey? I don't
That-
know. Gerald, maybe when you can just bring that picture up, that would be great. Is that okay with you? We're just
Oh
gonna,
my goodness, yes.
okay,
So the first
okay.
picture, he had just gotten out of the bathtub and I didn't have any peak retractors. And the second picture was just several months later whenever we were going to camp. But I
Wow,
mean,
so
you
that's
can
only
tell.
four, that's like less than 4 months later.
Yes. And so we got 8 millimeters of expansion. We did have a lower expander in, but we didn't have to get too much out of that expander. Everything
Mhm.
lined up perfectly. But we're going to keep the expanders in a little longer and then we'll transfer him over to the Vivos guides.
Okay, excellent. And then the difficulty, I mean, I think so many people are fearful of trying something new. Can you kind of walk through the barriers you faced and how you broke them so you can get this result?
Yes. So I think my main concern is I didn't want my friend who's an orthodontist to think that I was like encroaching on his territory. And so I met with him and told him that I'm trying to fix the foundation and the issues that these children are having. And you can straighten the teeth later if you
Okay,
want to. But I also did send him a link to one of the Airway Health Solution courses specifically
thank you.
for orthodontists, which was
Yeah.
really cool. But I don't, what was the original question? I think I went over to.
There is a barrier, like or maybe we can kind of rephrase the question of
Yeah,
what advice would you give for someone who, because I'm looking at this
yeah.
4 months, you put upper and lower expanders in. It's really, I hate to simplify things so much, but it's not that complicated.
No, it's not. And I think that it is scary trying something new, but the thing that gave me confidence was having the Airway Dentists Facebook group where I could ask questions, and have so many people who've had way more experience than I have kind of walk me through it or give me helpful advice. And I mean, it is like you said, like, to hate to oversimplify it, it is like so simple what you're doing, and it makes such a huge difference. Like, just start with one child or someone, I mean, your own child,
Right.
and you can see the process and get comfortable with the turns of the expanders. And then you can be even more confident when you're sharing this information with another family. The
Thank you.
second, the other child I treated outside of my family, he's still in his expanders, but he had headaches several times a week. He's had one headache since starting the expanders, and it was right after he got off a roller coaster ride. So I blame that on the roller coaster.
Right.
um,
Right.
I think that it is scary to try something new, but just it's it's too awesome to just not try. So you just got to go for it.
Right. It's amazing. And so now you're a pediatric specialist. You had extra training in this. What do you think the resistance is in your specialty to for earlier intervention, or do you see any resistance, the
So
barriers?
we learned in residency, we did a lot of expanding, but it was just if there was a crossbite. And so I was comfortable with doing expanders. And I'm sure some people learn this just in dental school without going into any specialty, but that did give me a little bit of confidence. I'm used to cementing space maintainers and habit correctors and Nances, lower lingual holding arches. And so I could see how cementing an appliance could be a little intimidating, but when you take the course and you're given step by steps and how to do it, once you do it the first time, it's the easiest thing. You're just really comfortable even after one time.
Great, thank you. And what about the new guideline the pediatric association gave us? What are your feelings on that? Do you
So
feel?
on the airway, which ones are you
Mhm.
talking about? Yeah,
Yeah,
I'm so
on
excited.
just kind of the right to to do airway early.
Yes. No, I think that it's wonderful. And I hope that because they have put that out there, that so many more pediatric dentists or general dentists who treat children kind of take that and run with it. Because, I mean, I see this just taking off like wildfire. I mean, once you see
Yeah,
it,
I
hear
see you
about it,
taking off like
yes,
wildfire too.
it's just you learn it and you're just, I mean, it just becomes a part of your life. And it's really the coolest thing that I've ever done.
And then what would be your advice to any doctor, whether they're general dentist, orthodontist, pediatric dentist, who's on the fence about airway?
Sign up for one course. Just do it. And you'll never turn back.
There you go. Well, it would be great if it's simple as that, because then thousands of people can be saved. We need more airway dentists on
Yes.
our locator. We need more airway dentists in the world. So I thank you for contributing your story and for the work you do and for taking the road less traveled. So kudos to you and your growth. And in turn, your patients are going to breathe, sleep, and thrive better. So that's our mission. So thank you for being part of that.
Well, thank you for the courses you offer. I've enjoyed every one of them.
And then if people are seeing this in your area, I guess you can go to their Instagram. We're having that in the copy where you can see how to find Dr. Nix. And I'm sure you're giving consultations,
Yeah,
correct?
for sure.
Okay, wonderful. All right, well, thanks for your time. This is fun and keep
Oh,
up the great work.
thank you so much. Y'all have a wonderful weekend.
You too.